Most of us know that a lifetime of poor diet and lack of exercise can lead to atherosclerosis, the buildup of plaque in your arteries. It's often called the silent killer because it doesn't announce its arrival, but quietly contributes to heart attacks and strokes, the two leading causes of death worldwide. But what if there was a possible solution to this health problem that was revealed in a large clinical study involving over 1,000 people? This clinical study discovered that a natural enzyme from a traditional Japanese food reduced existing arterial plaque size significantly by up to 36% on average after 12 months. Today, we're diving into the science behind nattokinase, an enzyme from fermented soybeans. We'll cover the exact dosage used in the study and why lower doses do not deliver the same benefits, and why the effects appeared even stronger in certain groups like smokers, those who drink moderately, or people who are overweight. Stick around, because if you're taking the standard dose listed on most supplement bottles, you are not getting the full potential benefits. This is natto, a traditional Japanese dish made from fermented soybeans. It's known for its strong smell and sticky texture, but researchers have studied it for years due to its health properties. A long-term Japanese study of roughly 30,000 people found that regular natto eaters had about a 43% lower risk of death from heart disease. The key compound is nattokinase, a fibrinolytic enzyme that helps break down fibrin. Fibrin is the protein that forms the mesh in blood clots and arterial plaque. Think of nattokinase as natural bioscissors that can help clear some of that buildup. This is where dosage matters a lot. The key study we're discussing is a 2022 clinical analysis published in Frontiers in Cardiovascular Medicine, with 1,062 participants whose average age was around 67 years old and who had mild atherosclerosis. They were tested with different doses of nattokinase as measured in fibrinolytic units, also known as Fu. When supplementing 3,600 Fu per day, there was no significant effect on lipids or plaque reduction. But at doses of 10,800 Fu per day for 12 months, participants showed meaningful improvements, significant drops in LDL cholesterol and triglycerides, plus reductions of around 22% in carotid artery intima media thickness, and also up to 36% reduction in plaque size. Most over-the-counter nattokinase supplements recommend around 2,000 Fu per serving. According to this research, that's well below the level needed for noticeable changes in arterial health. Interestingly, the plaque-reducing effects were more pronounced in groups you might not expect, like smokers with approximately 37.5% plaque reduction, and those drinking more than 3 ounces of alcohol per week with approximately 39.1% plaque reduction, and overweight participants with approximately 39% in plaque reduction. Researchers suggest this could be because these groups often start with more plaque, so the relative improvement looks bigger. Exercise amplified the benefits as well. People taking more than 5,000 steps per day saw a 21% greater plaque reduction than sedentary folks who had no exercise. Combining nattokinase with regular exercise, such as walking, appears to be a powerful combination for better circulation and results. But is it better than prescription medication? Well, there's no prescription medication that clears arterial plaque by an average of 36%, so nattokinase is the clear winner in this metric. With regard to cholesterol, one study actually showed that nattokinase can, in some cases, reduce lipid levels more than the statin drug Zocor. But generally, statins are superior at lowering LDL cholesterol and triglycerides, and you shouldn't replace statins with nattokinase but have them work together synergistically. Another study showed nattokinase significantly drops blood pressure in hypertensive patients, possibly by acting as a natural ACE inhibitor. But we have to be honest about the limitations of this study. This specific 12-month study did not have a control group, so we cannot discount other factors like diet and exercise. Additionally, on a cautionary note, because nattokinase is such an effective blood clot buster, people on prescription blood thinners should consult their doctor before adding high-dose nattokinase to their regimen with prescription blood thinners. While it has been shown as a powerhouse for those with high blood pressure or high cholesterol, we are still waiting on studies to see the exact effects on perfectly healthy individuals. Heart disease does not happen overnight. It is a slow build-up over decades. But emerging science is finally discovering the tools we need to clean out our vital arteries. If you are looking into nattokinase, check your labels for that AFU count, because the dosage literally makes the medicine. In the description below is a link to buy a nattokinase supplement at or greater than the proper therapeutic dose. Taking control of your cardiovascular health is a marathon, not a sprint, and having the right tools and information is your best head start. Please make sure to like and subscribe to the channel for more tips to beat the diseases and maladies of aging and life. And drop a comment on whether you found this video helpful. Thank you for watching.